Well, welcome, CJ. We are so excited to have you. Of course, we love our friends at DAP Health, and there's a new initiative in town, harm prevention, which I understand you've been trying to really implement for the last 5 years.
Thank you for having me, and we love you too. Yes, it's been 5 years now, off and on, that I've been trying to get a program like this to happen. I knew how vital this program is because I've done work in this program before in Colorado. But I want to acknowledge that there's a group of so many passionate people who've tried for over 20 years now to try to get a program like this up and running because they've also seen the benefit and the needs in the community.
And you said that over, the country, there are over 200 programs, but we didn't have anything here in the Coachella Valley, and it was vital to get it started. So explain to our viewers exactly what the harm prevention program is.
Well, first I'm going to back up and say this program is not new. Like you just said, right? There's 450 of these programs nationally.
Wow.
So this program's not new. However, it's desperately needed here in the Coachella Valley. And I think DAP Health is the best organization, along with all of our partners, to make this program happen. And it's going to be a harm reduction program. And there's going to be two major components to this harm reduction program. The first one is going to be overdose prevention. And so that's where we're going to administer Narcan throughout our mobile clinic across the Coachella Valley. What the Narcan does is it's a nasal spray, and it will reverse anyone from dying from overdosing on opioids. And this is significant. We've seen through the COVID pandemic, we've seen an increase in deaths caused by opioids and by overdose. And Palm Springs itself, in the 92262 zip code, has seen a 300% higher death rate caused by opioid overdose compared to the state average.
Wow, that is shocking. So you'll have that mobile unit, and then I know there's another component as well.
There is. The second component is the syringe service program. A lot of people may know that as the needle exchange. And we received DAP state authorization from the state health department on January 10th to be able to operate a syringe service program in the city of Palm Springs. And we will also be operating out of our mobile clinic, providing those services as well.
Wonderful. And I know that this doesn't get funded by itself, so you've had a lot of help both locally, but also I understand the Biden administration has been behind these programs.
Absolutely. The Biden administration and the federal government has released millions of dollars because they've recognized the opioid crisis. It's a national crisis. We also have huge partners in the California State Health Department and also Riverside County as well.
And this is at no cost.
It is. The services will be free, and we know, right, stigma and shame. This organization, DAP Health, was founded through the AIDS crisis. We know stigma and shame will prevent people from accessing medical and social support services. So this program, the harm reduction program that will be in our mobile clinic, will be offering all these services free, without stigma, without shame, and we're here to meet people where they are at in their journey with addiction.
Wow. Well, CJ, congratulations to you for hard work for 5 years to finally get this program up and running. We need it in the Coachella Valley, and what a wonderful resource to know that DAP Health and you have stepped up to finally make it a reality.
Thank you, and I just want to say a big shout out to all of our community partners that we have and the ones that we'll be enhancing relationships with that allow us to bring the mobile clinic out there and access to their clients to be able to get this life-saving medication Narcan to people, and then also be able to provide the syringe service program as well. Because it's not just about people bringing in used syringes and getting new ones. It's what else can we help you with today? Do you need tested for HIV or hepatitis C? Would you like to see a therapist or a counselor, or go into a treatment or recovery center? So it looks differently for everybody.
It does. And you said there's already a number to the amount of people you've already helped.
We did. We've already distributed Narcan, so we're distributing Narcan out of the mobile clinic. We started that the very first day in January of this year, and we're excited to continue to expand our reach across the Coachella Valley by offering the syringe service programming that will be in Palm Springs, but anybody in the county and the state can come to us and access those services for free.
Wonderful. Thanks so much, CJ. Really appreciate it. Very proud of you.
Thank you for having me.
Thanks.